Good morning, everyone. So today we're going to be working a little bit more neck and shoulder. I want to work this a little bit related to AFib. I'm currently dealing with a little bit of AFib, have been for a little bit more over the past couple days. A lot more tightness and tension in left side shoulder, especially going down into the thoracic outlet. I attribute my AFib to a biomechanical issue in shoulder and neck. My right shoulder tends to be more internally spiraled, creates a lot more tension, puts restrictions on nerves, vagus nerve, also on some of the spinal root nerves that come out of the neck. That spiral through my shoulder turns into a spiral that is related to my hip, specifically left hip. So working on getting those to unravel, getting into the neck, trying to get some release from that tension to kind of free the nerves from that fascial matrix that tends to get tight and restricted. And tight and restricted can be in two different ways. We can have short and tight. If you think of each of these fingers as muscle fibers, and in between these muscle fibers are vasculature, veins, arteries, neurology, nerve vasculature. If the muscle fibers are shortening, it can pinch on those those vessels. And if it goes long, gets long and tight, you're also have the ability to get pinch on those vessels. So we can have issues with things being long and tight or short and tight. So it can be issue on the side being short, or it can be an issue on the side being long. So ultimately what I want to work on is having balance, so things are at their normal tension instead of being pulled more to one side out of balance. So with all that, we're going to get started. We're going to start with some standing crocodile breath. So I want to make nice big C shapes with our hands. Thumbs are going into the low back musculature. Index fingers are wrapping around to get a little bit of the abdominal musculature. And the palms are pressing into the side body to feel that side body musculature of the abdominal wall. And I want to cinch the hands in just a little bit because we're going to create resistance using our hands for the inflation of that abdominal wall as we inhale, like we're blowing up a balloon. We're going to inhale in through the nose and a nice exhale out through the mouth. And as we exhale, I want to feel the navel drawing up and in like you're trying to touch your spine, your vertebrae with your belly button as you exhale. We'll get a good 5 to 6 nice slow breaths. This can be anywhere from like a 3-second up to an 8-second inhale and exhale. Although since we're standing, I'm going to suggest keeping your time short. I don't want you to get dizzy or lightheaded. And if you do feel dizzy or lightheaded, please sit down, get into a comfortable position. So again, nice inhale. See if you can feel that abdominal wall pushing out into the hands. Exhale. Feel that navel draw all the way into the spine. Cinch the hands down a little bit in order to have more resistance. To feel that inhale. And on that inhale, can you feel that breath moving forward, pushing into the index fingers? Can you feel it moving, pushing back into your thumbs? And can you feel it pushing out through the sides? And if you're feeling difficulty of getting that breath to move into, maybe it's one side doesn't move as well or doesn't move well into the low back, then this is a breath practice that I would recommend working on daily and really throughout the day to build the neurology of that expansion of that wall of the abdominals on your inhale. As you inhale, you may notice your shoulders lift and rise and gain some tension. I want to make sure on the exhale, we're allowing that tension to release and keeping the shoulders nice and soft. We're going to go ahead and let the hands drop down to the side. We're going to continue with that breath, but we're going to get into some pelvic tilt. So inhale, breathing into the belly. I want to let that pelvis start to tilt forward so that we get some sway in our lower back. That belly is going to reach kind of forward. As we exhale, we're drawing that navel in, and I want to scoop the pelvis like we're getting a little rounded in that low back. Inhale, feel pulls that pelvis forward, belly opens up, low back, nice sway. Exhale, scoop. And we're going to start to add in some shoulders into this. So we can take our hands, spread the hands nice and wide. On your inhale, turn your palms up to the ceiling as high as you can. Notice how that opens, it lifts the chest up a little bit. And as we exhale and scoop, we're going to spiral the thumbs down to the floor as we lightly reach forward, getting this nice rounding into the upper back. Inhale, let the shoulders shrug up and then drop down as the hands come back down to the side, palms spiraling up to the ceiling. Exhale, shoulders shrug as we roll forward and reach. With each one, see if you can make your movement a little bit bigger. How much can you spiral those palms up to the ceiling? Can you get more spiral through the arms? Can you feel more opening through the chest? On the exhale, can you reach, scoop, and round a little bit further? Go ahead and shake the arms out a little bit. Now we're going to get into our bowls of soup. So I'm still keeping hands nice and spread. Palms are facing up to the ceiling. And we're going to spiral through one shoulder at a time. So it's going from palms spiraled up, thumbs turning down, and we're internally spiraling as much as we can through the long arm bone all the way up to the shoulder. See if you can feel some stretch around that shoulder, spiraling that palm up and then doing the same thing to the other side. I am exhaling as I spiral my arm in, inhaling as I spiral it back, exhaling as I go to the other side. And as we're doing this, we can start to slowly elevate the arms. I want to make sure that we don't get into a position where we get pinch or pain. But as we're doing this, notice if there's a difference in one shoulder compared to the other in how far you're able to internally spiral versus how far you're able to externally spiral. Is one side a little tighter, a little stiffer in one direction? Is it a little crunchy? Is there some popping or crackling in one shoulder more so than the other? My left shoulder is tighter and more restricted, especially as I get into this internal spiral. And I feel a bigger stretch as I get into the external spiral. Now I want to start to combine the movements of our arms as one arm is spiraling up, the other arm is spiraling in, and we're going to allow the shoulder blade to round over. It's where we get this nice kind of contorted upper back. As we go from one side all the way through. Imagine from fingertip to fingertip, you're a wet washcloth and we're wringing out that washcloth. I want to actively reach away with fingertips like we're trying to touch the wall, creating as much traction as we twist. Now I'm getting a little popping and crunchiness in this left shoulder. So this left shoulder, I assume, is related to what I got going on in this upper neck, this thoracic outlet area, and is part of what's causing my AFib. Go ahead and relax the shoulders. We're now going to go ahead and pick up our staff. I'm going to start with about shoulder width grip on the staff. I want to have a nice grip like we're trying to bend or break the staff in two. So I want that bend to come at the wrists, elbows, and shoulder blades. So elbow pits should be spiraling up towards the ceiling. Shoulder blades should be packing down, rolling down towards our back pockets. And we'll start with the staff at our side. We're going to come back to that breath of inhale into the belly, allowing the pelvis to tilt forward. Exhale, navel to spine as we scoop. We'll get 3 to 5 breaths, moving back and forth. Again, feel that nice scoop forward. Exhale, draw that navel in as we scoop. On your next inhale, as we exhale, at the same time that you're scooping your pelvis, we're going to lift those elbows up, seeing how far can we pull the elbows towards the ears. I do not want to go into pain. I also don't want to go so high that we pull our pelvis forward, getting into this sway back. I don't want the ribs sticking out. So we're scooping at the same time that we're lifting. Core should be engaged. Don't overextend through the arms. If you're only able to go so high, that's fine. This is our end range. Inhale, belly opens up, sway in the back. Exhale, scoop as you pull lightly. I want to get at least 10 slow reps with each one, seeing if you can slowly squeeze those elbows a little bit more towards the ears or behind the ears. Notice, how does this feel on the right shoulder compared to the left shoulder? After 10 of those, we're going to move the staff behind the back. Palms are facing backwards. I still want to imagine that we're trying to bend that staff, but we're bending it away from the body. So elbow pits should still spiral forward. Feel those shoulder blades pack down and back. Continuing to get that nice inhale into the belly. Exhale, we're lifting elbows slowly up towards the ceiling. Inhale, let the shoulders drop. Exhale, lift and squeeze. I want to continue to try to bend or break the staff as I'm lifting. That spiral action of trying to bend should add more stretch opening through the front of the chest. And again, at a minimum of 10 slow reps. I don't want to force it. I want to squeeze gently, seeing if we can get a little further, but I don't want to try to force range of motion. Again, notice how this feels left side compared to the right side. We're then going to spiral the palms, so flip our hands over so the palms are now facing forward. Staff still stays back behind. We're still trying to bend the staff away from the body. So you're going to feel that push through the thumbs on the staff. Everything else is the same. Nice inhale into the belly. Exhale, draw the navel in as you lift and squeeze, and continuing to bend the staff. Get a minimum of 10 reps, nice and slow. As you're getting into these, we can start to soften the knees and get a little bend at the hips. That will give you a little bit more room to explore the shoulders lifting up towards the ceiling. But I want to watch out for the head dropping. Try to keep your spine tall. Continue to bend that staff. I want to feel those shoulders, those arms spiraling open. I want to watch out for the shoulders rounding forward as we're doing this. Get my left shoulder a lot tighter, especially through this upper part of the front part of the shoulder. All right, we're going to come back, flip the palms back over so that they are palms are facing back. And now we're just going to actively reach, like we're pushing the staff all the way to the floor, continuing to bend the staff. But I want to feel those shoulder blades downwardly press, reaching down like you're trying to touch your back hip pockets with the shoulders. And from here, we're going to get into some light neck mobility. Now, if you feel dizzy or lightheaded, I would prefer that you sit to do this next movement. From here, getting nice breath in through the nose, out through the mouth. Inhale, we're staying at center. Exhale, we're slowly looking over the left shoulder. Inhale, back to center. Exhale, looking over the left shoulder. Again, notice how does this feel looking to the right compared to looking to the left. As we turn, I want to make sure that we are not tilting the head and reaching with our forehead. I really want to focus on reaching with the chin, trying to see how far can we get that chin over the edge of our shoulder. The more we reach with that chin, the deeper you'll feel that mobility into the neck, into that upper neck region. Again, my left, looking to my left, is tighter than the right. Next, we'll come back to center and we're going to do our light tilt and lift. So very lightly, tilting the head like we're dropping the ear very lightly to the shoulder. I don't want to go too far. This very light tilt, opposite ear, we're lifting up towards the ceiling. Imagine that you have a piece of string attached to your earlobe that's pulling your ear, or that you're trying to actually touch your ear to the ceiling. You're going to inhale as we're back at center. Exhale as we tilt and lift. Continue to be actively bending that staff, and as you lift that ear, you can actively reach the staff down to the floor. You can notice, how does this feel on that left side compared to the right side? Do you have the same access to mobility? Does it feel tighter, more restricted? Does it just feel difficult to even do? My right side, I feel like I have a lot more mobility. My left side feels tighter and more restricted. Good. We'll go ahead and set the staff down to the side, and we're going to come all the way down to the floor on our back. And we're going to get into some light baby rolls. So arms are going to come up into a nice big Y position. With baby rolls, we're going to be working some movement through our spine. So if you have low back pain, any kind of spinal pain, you need to go extraordinarily slow, and if it is painful, then I want you to back off And better off skipping this movement and scheduling a consultation with me so we can talk about it. So arms are in this nice big Y. I want to have light pressure through the heels. I want the toes straight up towards the ceiling, and we can actually lightly pull the tops of the feet back like you're trying to fold them and touch your shins, and then lightly pressing down with about 5 pounds of pressure into the floor. And from here, taking a nice inhale in through the nose, and as we exhale, we're going to lift our head as we reach our left hand across and match it to our right hand. The head has to come off the floor, so does your shoulder. Your hip will also lift off the floor lightly. Inhale as we come back to the floor. Exhale as we reach the right hand to match the left. Feel that light engagement, even engagement with the heels into the floor. And as you're going back and forth, notice if this is more challenging to reach with your right hand than your left hand. Is it harder to keep your heels in contact with the floor in one direction than the other? Is one side tighter? Maybe in the low back, maybe up in the shoulders or in the neck. Which direction do you feel that you're more ease compared to the other side? When I reach with my left, it's a lot tighter. I get stretch in my low back as well as up into the shoulder. When I reach with the right, it's significantly easier. I still get some good stretch, but it does not feel quite the same. On the next one, actually, let me finish off so I can come to the other side. As we reach, I want to reach to a point of light tension. Spread the hands nice and wide. And we're going to do some very soft bowls of soup, spiraling through that long arm bone. I want to make sure that this is not painful as we do this. And we'll get in 5 nice bowls of soup, 5 up to 10. With each one, you can continue to reach your fingers further, like you're trying to roll and reach further as you're spiraling through. Keep contact through both heels as you're doing this. We'll bring it back and we'll go across to the other side and do the same thing. Get nice, slow bowls of soup. Start small and then open up more and more as you find that it's not painful and it feels good and juicy. We'll bring it back to center, keeping the arms up in our nice big Y. Now we're going to move through our feet. Going to lift one leg up high, reaching across the body. I want to keep that leg high like we're reaching up onto a shelf. It's going to lift the hip. We're going to reach, allow it to lift up your shoulder, but try to keep some contact with the hand. Inhale as we bring that leg back down. Exhale as we lift and reach across. I want to make sure that that leg is not dropping down to the floor in order to avoid any kind of pinch or discomfort in the low back and the hip. So keeping it nice and high. As we're going back and forth, as you lift and reach, extend those toes. You can also reach away through your fingertips in order to create that nice traction stretch. We're seeing how far can we get toe tips away from fingertips. Again, keeping some light contact with the back of the hand. Shoulder blade should be lifting off the floor a little bit as long as it is not painful. After we get 5 to 10 reps, on the next one, as you reach, we're going to reach and allow a little bit further and allow that hand to come off the floor as long as it is not a painful position. Spread the hands, and we're going to very slowly go through a bowls of soup again. Now, be cautious. We are in tension in this shoulder. So I want to go start small to make sure it is not painful. Keep those fingers spread wide. Continue to reach through the toes and away through the fingertips as you're going through those bowls of soup. Then we can bring it down and go across to the other side, doing the same thing. Again, nice reach, reaching a little bit further so that the fingers come off the floor. Spread the hands, start small, and work to get a little bit more range. Now my left shoulder is more sensitive. It's actually, if I'm not careful, there's a little bit of a pain pattern. So I have to adjust this shoulder in order to continue to get that reach without it being painful. So I have a very specific tension pattern through this shoulder related to my spiral, especially internal and coming back through external. And there's also a little bit of popping and, just a little, it's crunchy in there. I have a lot of compression through this shoulder and this upper, really the whole thoracic region. A little bit elevated the past couple of days. Bring it back down. And now we're going to slowly move into our quadruped position. So coming to hands and knees. We get on hands, I want to spread fingers nice and wide. Before we do this, I'm kind of checking in. My arrhythmia is gone. It's back to normal. So what we've done so far through the shoulder seems to have helped. So spreading fingers nice and wide, grounding palms, tucking the toes, especially the big toes. We're going to inhale as we rock forward, getting a little bit of load into the wrist. I want to feel some mobility work in that wrist. Exhale, we're letting our hips sink all the way to heels to feel that. I want to feel the weight of our hips. Load the big toe joint, get some stretch into the arch of the foot. Inhale, we're coming forward into the wrist. Exhale, sinking into the toes in the arches of the feet. As you sit back, imagine that you have a tail and keep that tail turning up towards the ceiling. Don't let that butt scoop as you sink back. So kind of stick that tail up as you feel that weight load into the big toe joint and arches of the feet. Notice if one big toe feels tighter than the other. If you notice that you had some tension differences in the shoulders, it's going to be important to notice if there's some tension differences in the big toe, because it's going to be related. My left big toe right now is tighter than my right big toe. Which is not always the case. They tend to go back and forth. But my left big toe tends to get tighter when I have this same spiral issue in my left shoulder. So my issues in my left going on through my foot go all the way up through the left shoulder. On the next inhale, as we exhale, we're going to sink into light tension, not heavy tension, and we're going to stay here. And we're going to do some windshield wipers through the feet, letting the heels roll all the way out so that we can see if we can get tucked underneath all the way to the pinky toes and then all the way back to the big toes. Seeing how close can you get your heels to touch without going into pain in the big toe joint? How far out can you roll those heels? We'll come back up to our starting position. I want to keep those toes tucked. Don't let those ankles go flat just yet. We're coming back into our breath, breathing in through into the belly. Allow the pelvis to tilt to the floor so that we get some sway in our low back. And we're just going to focus on pelvic tilts. So on our exhale, we're scooping the pelvis as we draw that navel into the spine. But I don't want to let that movement go up into the upper back. We're not doing a cat-cow just yet, so I don't want to round the upper back. If anything, I want to spiral those elbow pits so that they're facing forward. Feel the shoulder blades pack onto the upper back like they're moving down to the back hips. And then keep that locked so that the shoulders don't move. Inhale. Let that belly open up to the floor, big sway in the low back, making sure we're not going to pinch or pain. Exhale, scooping the pelvis as far as you can without that movement going into the upper back. You should get some decent stretch into that low back, especially on the exhale and scoop. Notice how tight and tense does it feel. I have some tightness in that low back, more specific to the right side of the spine. Now, as we're getting into this, we can start to let the movement move up the rest of the spine. So as we scoop, continue to scoop. Feel it moving up the spine. As it gets to the shoulders, we can let those elbow pits spiral in, pushing through the floor. Allow that movement to go over the top of the head. Imagine that you're trying to touch tailbone to forehead at this imaginary spot right here in the middle. Inhale, scoops forward, drawing the belly down, sway in the back. Spiral the elbow pits forward so you feel those shoulder blades packing down on the back as the head comes up last. I want to think spinal wave. Your pelvis, your tailbone is the beginning of the wave. And can you feel each individual vertebrae moving one at a time towards the floor with the head coming up last? And then on your exhale, can you feel that scoop moving each vertebrae one at a time until it gets to your head? And do you notice any particular spots or segments of the spine that feel tighter and more restricted? Good. All right, so we're going to change positions again. We're now going to get into our inverted position. Actually, I want to start in V-sit. So we're going to get wide feet. Knees are actively reaching down towards the floor. We're pulling the tops of the feet back like we're trying to touch our shins. I want to be very active here. If you're reaching down with those knees and pulling back, you should notice that your quads are a little bit engaged. Our palms are coming down to the floor behind the hips, pressing down, and we're spiraling those elbow pits out and away, feeling that packed shoulder, nice, tall, lifted sternum. And we're going to get into our bowls of soup basically with our knees, doing knee spiraling through the knees. So I want to focus on the kneecaps. We're on the exhale, we're seeing how far can we turn both knees out as if you're trying to touch your kneecaps to the floor on the outside. Inhale as we come back to the center, and then spiral in with those kneecaps. How far can you turn in towards the floor? I'm focusing on the kneecaps and not on the feet. I want to see how far do the kneecaps go, because the kneecaps are going to give me a better indication of how much rotation I'm getting in the hip. I can get a lot of movement through the feet without my knees moving at all, which means I'm not getting any rotation in the hip. So pay attention to the kneecaps. Exhale as we spiral out. And notice how far does the right kneecap go compared to the left kneecap. Inhale as we come back to the center, and then exhale as we spiral internal. Again, how far does the kneecap travel on the right side and the left side? Try to keep those elbow pits spiraled out, shoulders packed, chest is nice and tall. Is one hip a little bit tighter and more restricted than the other hip, especially moving in one particular direction? My left hip moving internally is tighter, which is the same issue I'm having up in the left shoulder. So there is a common movement relationship here between my left hip and my left shoulder. Good. We're going to let the hands come up off the floor. I want to stay active in our V-sit. I'm still actively reaching down through the knees, actively pulling the toes back. Now we're going to get into a little bit of nice soft fold. So nice inhale as we're tall. Exhale. We're seeing how far forward can we slide our hands. Inhale is bringing us right back to tall. Now, as I do this with each one, we're seeing if we can slowly reach a little bit further. But what I want to make sure that we're keeping our spine nice and tall. So as I reach, I don't want to drop my head and round my shoulders and my back to try to reach to the floor through my head. I'm focusing on my hands sliding forward, keeping that nice same position of the spine. I'm not concerned with how far forward we go. I do want to notice how it feels through the left hip compared to the right hip. You may not notice a big difference as we're reaching forward. So we'll start to go a little bit side to side. As I reach to one side, I want to turn the shoulders, keep the shoulders and the hands square together. As we reach a little bit to that right side, and we can do the same thing reaching to the left side. As we go side to side, you might feel a little bit more tightness in the back of the leg, back of the knee, back of the leg, or you may feel it in the low back. It's going one direction harder than going in the other direction. My left hamstring is tighter, going to my left side. Right side feels pretty free and easy. I also feel right side low back when I reach to my left side. So again, kind of collecting data on how movement related on my left side is different than my right side and how that might be related to what's going on with my AFib, as well as other pain patterns. We can continue to kind of reach further where you're now reaching out through the heels. Again, is one side easier? Are you able to reach further than the other side? I do not have quite as much range of motion going to my left right now. Good. We're now going to let the V-sit go. We're going to bring our knees, bend our knees, bring our feet in, grounding hands behind our hips, getting into our inverted sit position. From here, we're going to get back into some spirals or bowls of soup action through the shoulders. So palms are grounded, fingers can be out to the side, they can be facing forward, they can be facing back, whatever feels comfortable. I like mine out to the side, and we're going to start with just simple elbow spirals. Spiraling the elbow pits out and away, and then spiraling them in towards the body. And as we spiral the elbow pits, notice how that naturally moves our shoulder blades. As we're spiraling out, press down into the floor. Feel the chest open up and try to get nice and tall as you can through the spine, and feel that sternum lifting up towards the ceiling. As we spiral internal, allow that shoulders to round and roll forward, lifting like they're lifting up towards your ears, rounding the upper back. And then inhaling as we get nice and tall. We're going to exhale as we internally spiral, drawing that navel in, and we can also start to scoop the pelvis as we're rolling those shoulders forward. Inhale as we're opening, lifting, getting nice and tall through the spine. On your next inhale, as we externally spiral, feel those shoulders pack and we get tall, we're going to stay tall. So I want to keep spiraling. At this point, you can change your foot position if it's more comfortable to get into a cross leg, but I want to continue to have those palms pressing down, elbows spiraling out and away. So nice open chest, sternum's lifting nice and tall. And we're going to do a little bit more neck mobility now. So coming back to checking our blind spots. Nice exhale as we look over the right shoulder. Inhale back to center, and exhale as we look over our left shoulder. This is our second time getting into neck mobility. We're in a different position, so I'm going to be curious, how does it feel? Does it feel a little bit different? Is it more mobile, or are you feeling is it more tight and tense on one side than it was earlier? I feel like I have more mobility in my neck in general. I can go further in both directions. But because I can go further in both directions, I'm feeling a very specific tension pattern on this left side, especially at the end range of my blind spot. It's actually opening up as I get into it. So I'm getting a little bit more mobility and some relief in that tension. And we'll come back to center, and we're going to get into our tilts and lift. So light tilt, lifting that ear up like you're trying to touch the ceiling. Inhale as we bring it back to the center. Exhale as we tilt and lift to the other side. As you tilt and lift, you can also ground and press through that same side palm. So as I'm lifting my right ear, I'm lightly pressing my right palm down in order to create a little bit more traction. Inhale, softening, exhale, doing the same thing on the other side. Again, that left side, definitely tighter and more restricted, although I feel like I'm getting a little bit more range, which is also allowing me to get a little bit more stretch. I don't want to force this. I don't want to force that stretch. So I want to get into the juicy nature of the stretch, but I want to stay soft with it, especially with the neck. I feel like that opened up my neck a good amount. So now last thing for the neck is we're going to do some shallow neck rolls. So continuing to press down through the palms, keep those elbows spiraled out and away, shoulder blades are downwardly pressed. We're going to let our chin lightly drop down to chest. Let that right ear roll to the right shoulder. Then our gaze can come up to the ceiling, left ear to the left shoulder, and then chin back down to the chest. And we got 4 points that we're going to slowly smooth out into a circle. I do not want this to be painful, so if it feels tight and restricted on the edge of pain, keep the circle as shallow as necessary for it not to be painful. As you get into it, you may find that you get more range and you're able to go a little bit deeper. But I do not want to force this. If you force it with the neck, it is very likely going to make the neck tighter. So I want to be soft and safe and non-forceful. As we get to 5, we're going to stop and we're going to go the opposite direction, but we're going to start shallow again. I do not want to go at the same depth you were just at. So chin to chest, lightly dropping left ear to the left shoulder, gaze comes back up to the ceiling, and then the right ear to the right shoulder, and then chin back down to chest. And then slowly move that 4 points into a circle. You may notice that moving the circle in one direction feels tighter than when you go in the opposite direction. This direction of my shoulder, as I roll from the back around to the right side, I feel a lot more on the left side than I did going the opposite direction. Again, stay soft, supple, smooth, non-forceful, non-painful. All right, we'll go ahead and bring the arms off the floor. We can shake them out a little bit. We're going to now get into our shin box position. So making a nice box with the shins. I'm in my left side shin box. My left knee is forward. Left hand is coming down outside the hip, grounding that palm. I want to have our weight shifted over onto that side. So my weight is on my left hip. This is lifting my right hip off the floor. I want the right hip up. Palm is grounded. We're spiraling that elbow pit out and away. Feel that shoulder blade packed down. Nice lifted sternum. We're going to be working on this back hip. I want it off the floor and I want to keep our weight forward. One way to know that our weight is forward is this knee should be to the floor. If that knee is lifting up, that's going to be an indication that your weight is shifted back onto that back hip. So move that weight forward, keep that knee down. On our inhale breath, we're going to inhale into this back hip as we reach that hip to the floor without shifting our weight. So that knee should stay down. On the exhale, we're lifting that hip up. So hips coming up, reaching forward, and we're trying to scoop that tailbone. Like you're taking your tailbone and you want to reach it forward as a scoop, moving it in that direction. The more you can scoop, the more you're going to feel some stretch through the front of the hip. Inhale as we release that scoop, reaching to the floor without shifting our weight. Exhale, scoop. I don't want to turn the chest or the rib cage just yet. So I want to stay nice and square forward. Trying to get as much extension just through the hip. If we got movement up here, it can hide lack of movement here. So I want to keep that upper body still. How far does that hip travel? Are you able to touch the floor? Not a big deal if you can't, but how close to the floor can you get? We want to measure how far that hip travels between the floor, coming up, and how much scoop can we get. The more scoop you're able to get, the more you'll start to feel your glute tighten up, that muscle in the back. And if you can feel that tighten up, continue to scoop more and more to see if you can feel it really lock in and engage. And we're going to very slowly transition to a windshield wiper, letting our knees come up, rolling all the way through to the other side. Hand palm grounded to the floor. Weight is shifted forward. That knee is down. Elbow pit spirals out and away. Feel that shoulder pack down and back. We're going to be focusing again on this back hip. So nice inhale. Feel that hip reach to the floor. Exhale as we lift and scoop. How does this hip feel? Right off the bat, you probably notice whether if one side is tighter than the other. Are you able to get as far reaching to the floor without shifting your weight? Again, I don't want that knee lifting up. How far are you able to travel that hip forward and scoop into it without moving your ribs? My left hip does not travel quite as much to the floor, although as I do a few of these, it's getting closer. And on my exhale and my scoop, it's a little harder to get full extension. I'm getting some engagement in that glute, but it's harder on this side. Again, this is the hip that's a little bit more internally spiraled. It's also a little bit more compressed. So I got more restriction in this hip than I do on the other side. Although as I do more reps, I'm slowly able to get more range, more mobility out of this hip. We're then going to slowly windshield wiper all the way across. Again, I want the feet staying on the floor as we move from one side to the other. Palm is grounded, elbow spiraling out. We're doing the same thing with our hip. Reaching that hip to the floor, lifting it up and scooping. And now we're going to add another component. So as we scoop, I want to scoop and I want to lock that hip in. Feel that glute. Don't lose that scoop, that stretch in the front, and that active glute. But we're now going to add to it. Imagine you got a piece of bread in your hand and you want to reach through your knee and share it with your buddy Skeletor off in the corner. Inhale as we bring it all the way back. Feel that hip reach to the floor. Exhale, lock it in first, and then continue to exhale as you reach and share your bread. As you're getting into this, you can add one last little spiral component. So as we exhale, locking that hip, reach, spread your hands and see if you can spiral your palm up towards the ceiling and extend that elbow fully. Notice how that creates a lot more tension into that upper back. It kind of combines that what we're feeling in that mobility of the hip into our rotational core and then into that shoulder. And then we're going to windshield wiper nice and slow across to the other side. Palm is grounded, elbows pit spiraled out and away. Inhale, let that hip reach to the floor. Exhale, lift, scoop, lock it in, lock that glute in, and then rotate as we share our bread. Oh man. So left hip is tighter. As I scoop and I get into this rotation, my rotation is a lot tighter on this side, especially in my left side low back, which I did not feel in other parts of the assessment. So really important. And as we're getting into it, locking in that hip and reaching, we can now spread the hands and start to work on spiraling that palm up and extending that elbow as we share that bread. The more I do that, the more I really feel mobility in this left hip where I feel a lot of tightness and restriction. And I actually feel it opening up a good amount. I'm getting more range of motion as I move into it. Slowly, safely, non-forcefully. I'm not trying to push the range of motion. I'm working with where my body allows me to go comfortably and just lightly squeezing into it without forcing it. And the more reps that I do at that kind of slow, methodical pace, the more range I get. We'll go ahead and slowly windshield wiper back to the other side. Now we're going to get into our folds. So I'm going to use the shin. I want to stay square, chest square to the shin to start on this. So chest is square to the shin. Both hands are square to the shin. Nice inhale, filling up that crocodile breath. Exhale. Sliding hands forward, keeping square. I want to make sure both hands reach evenly. If one hand's reaching further, that means your shoulders are no longer square. Inhale as we bring it all the way back up in tall. And just like in our V-sit when we did our folds, I want to keep the spine tall. I don't want to drop the head and round the back. I want to keep the back nice and tall, so we're focusing on sliding the hands forward as we reach. Inhale, coming all the way back. And one last little bit of a cue for this. As you're sliding your hands forward, feel your tailbone reaching back. See if you can imagine you're trying to slide your tailbone back through the floor, opposite from your hands sliding forward. That may get you a little bit more sense of mobility in that back of the hip. Once we do 5 up to 10 reps, we're going to slowly windshield wiper across to the other side. Again, hands and shoulders are square to the shin. Nice inhale, spine is tall. Exhale, sliding both hands evenly. And are you able to get as far on this side? Are there areas that feel more restricted on one side compared to the other? Again, with each one, we can see if we can go just a little bit further. As I'm reaching forward through the fingertips, I'm reaching back through my tailbone, through my hip, seeing if I can, how far can I get that tailbone to reach away from fingertips. And I also want to try to keep the hip sliding on the floor. I don't want it to lift off the floor. So I'm sliding it back, but I'm trying to keep it in contact with the floor as it's sliding back. As we match reps on this side, we're now going to start to go back and forth. I want to stay in our windshield wiper for now. So as we go from one side, slow transition, keeping the feet on the floor. Once we get to the other side, nice exhale. As we reach, keep those hips sliding back as the hands slide forward. Inhale as we come back up. Nice transition across to the other side. I want to go very slow with our breath. At this point, I'm less concerned about keeping square with the shin. So we're not, that part of the movement we can let go of. But I want to continue to feel the difference right side to the left side. Once you do about 5 on each side, we're now going to start to open up our shin box. We're going to let that back leg slide open just a little bit more, making that shin box angle bigger, continuing to fold. Nice slow reach. Inhale as you bring it back. You can slide that leg back in so that we can transition to the other side. And then again, slide that hip back as we fold. And with each one, we can slowly open that shin box up just a little bit more. Notice the difference of how this feels right side to left side, especially as you open up that shin box. There's one side, does that back hip feel a little bit tighter on one side than it does on the other? My left hip, when I go to my right side, I have more tension through that left hip than I do on the right hip when I go to the other side. Again, part of what's related to what's going on in my hip and in my shoulder. And with each one, we're going to continue to open up more and more until we get closer and closer to what we would consider kind of a yoga class pigeon pose. Although I'm not overly concerned about getting into that full pigeon, especially if it's tight and restricted or painful. I do not want to force it. So I'm only taking it as far as my body feels comfortable with. With this particular flow, I like to do 10 up to 20 nice slow reps back and forth. Really great movement, especially early in the day before you go out and start your day. All right, we're going to come back to our starting point. Left side shin box, palm is grounded, spiraling that elbow pit out and away. And I want to finish with a little bit more light neck mobility. Since we're grounded down through that shoulder, we're going to be looking at neck mobility related to the shoulder a little bit more. So I'm on my left side, palm is grounded, elbow is spiraled out and away, and we're starting with checking our blind spots. Exhale as we look over that shoulder. Inhale as we come back to the center. And then exhale as we look over the right shoulder. Keep that palm lightly pressing down into the floor. Elbow actively spiraling out and away. Feel that shoulder blade actively sliding down your rib cage towards your back hip. Once we do 5 up to 10 reps, we're now going to do our tilt and lift. So tilt to one shoulder, lifting that ear up to the ceiling. Inhale as we go to the other side. The side that the shoulder is loaded, as you lift that ear up, you can lightly press down through that palm, grounding that shoulder. Notice that tension, that stretch, what you feel in the neck and the upper shoulder. As you get 5 to 10 reps, we're going to very slowly windshield wiper across to the other side, and we're doing the same thing. So nice grounded palm, spiraled elbow, packed shoulder, starting with checking our blind spots. Looking over that right shoulder as we exhale. Inhale to center. looking over the left shoulder. Now notice the difference in your range of motion in your neck on this side compared to what it was on the other side. You may find that when one shoulder is downwardly pressed, spiraled out, that you have more range of motion in both directions, and when you're on the other shoulder, it's restricted in one direction or both. And that's going to be an indication of some things going on related to the neck and the shoulder and your core. It's going to have some relationships to your breathing. So these are important assessment points that we can actually make very, very useful in our movement practice to get things moving better. Once we get 5 to 10, coming back to our tilt and lift. Nice lift up on our exhale. Inhale to center. Exhale as we go to the other side. So when I'm on my right shoulder, I have far more neck mobility than when I'm on my left shoulder. So that tells me that a good deal of what I got going on through my neck and into this thoracic is probably shoulder related, or some kind of instability in the shoulder or the shoulder and the neck in the way that they relate to each other. And there's also going to be a relationship into that left hip. More than likely the hip is tightening up in order to support what's going on in the neck and the shoulder. Good. Once we get 5 to 10, last thing we're going to do, come all the way back to our low back, making our nice big C shapes with our hands, thumbs in the low back, index fingers wrapping around to the front, and we're going to finish with some crocodile breath. Nice inhale, feeling that balloon, that abdominal wall expanding out in all directions. Exhale, navel presses into the spine, which is pressing into the floor. With each inhale, see if you can expand that balloon a little bit wider. And on your exhale, notice your shoulders, allow them to soften and melt to the floor. Inhale, it's kind of expanding into tension. Exhale is releasing that tension and letting it melt to the floor. We can let our hands fall, palms are facing the ceiling, allowing those shoulder blades to completely melt to the floor. Continuing to breathe and expand, we can bring that breath up into the ribs, upper back, up into the neck and shoulders. And then on our exhale, let all that tension melt into the floor. And when you're ready, you can open your eyes, very slowly sit up, and making sure that you're not dizzy or lightheaded before standing.